Hi, I'm Dr. Nima at EOS Rejuvenation in beautiful Beverly Hills. I wanted to go over some options when it comes to your nose, more specifically the difference between a non-surgical rhinoplasty versus a surgical rhinoplasty. The nose is the center of the face. It's just something that can't be hidden with clothes or anything like that, and in some people it can be a very distracting feature. Some people have a crooked nose or a bump on their nose or a droopy tip, and they come to see me to see what can be done about their nose. There are a lot of people who are scared of having surgery. There are some people who are not so scared and are very brave and just want to get something done that's more permanent. So today I just wanted to go over the two different options when it comes to dealing with your nose. The first one is the non-surgical rhinoplasty. Now, not everyone is a candidate for a non-surgical rhinoplasty. Let me tell you a little bit about the procedure. The procedure itself deals with placing fillers inside the nose to make a nose look more straight or to hide a bump. I can even lift your tip with it, and even from the front make it look a little bit more narrow. We use different types of fillers, usually from the Restylane family, occasionally from the Juvederm family, and essentially those results typically last about 9 to 12 months. It doesn't really hurt. We use some numbing cream. The procedure takes about 10 minutes. There's really no downtime, so you can go back to your life as quickly as possible. And I'll be honest, out of all the non-surgical procedures I do, the non-surgical rhinoplasty has the biggest wow factor. Even if you look at surveys done like on realself.com, the non-surgical rhinoplasty has about a 95% satisfaction rate among people. And I bet that 5% is because those people were improperly chosen for their procedure. Now, who's a good candidate for a non-surgical rhinoplasty? Typically it's someone who has a nose that isn't already too large for their face, doesn't have a lot of asymmetries, and just wants some minor tweaks and changes to their nose. For example, maybe you have like a little bit of a bump or the tip droops a little bit. I can put little filler on the tip to kind of lift it and put filler above and below the bump to make it look a little bit nicer. The person who's not that great of a candidate is someone who needs their nose to be significantly smaller. So it's like big bumps or really big, crookedness to the nose, or someone who just doesn't want to deal with coming into having fillers once a year afterwards. I think a non-surgical rhinoplasty is great for even important events coming up, like if you have a wedding or a bar mitzvah and you just want to look really nice for it. It's a really quick procedure to do, and you'll be happy afterwards. When it comes to the surgical rhinoplasty, that's again one of my main specialties. A surgical rhinoplasty, you have a lot more freedom to do what you want to do. You can make a nose smaller, you can straighten the nose, you can make a tip look cuter, you can lift a tip. Pretty much almost anything you want to do, you can do it surgically. Now obviously with surgery there's a little bit of downtime. The pain is really not that bad, but it's mostly some mild bruising and swelling that comes after it. Additionally, if you have any breathing problems, surgery is fantastic to help you deal with that as well. So what I will do is invite you to come in for a consultation and see if you're a candidate for one versus the other, and I'm happy to go over both with you.